Hello, my name is Emma Weekly, and this is the Unit 7 written assignment, the full head-to-toe physical assessment. There are other people in this lab with me right now, so please bear with me. This is at WVUP. So when you first walk in to your patient, you're going to introduce yourself, wash your hands, look at their general appearance, look at their mood and affect, look at their level of consciousness, and look at their overall demeanor. Do they look hygienic? Do they take care of themselves? This and that. So to get started on the examination, we are going to start with the head. And first you want to inspect and palpate the scalp. So when you're inspecting and palpating the scalp, you want the scalp to be a nice white color. The hair shouldn't be brittle. You want healthy hair. You can feel through the hair, feel for maybe any lumps, any abnormalities, any bumps they would have. Maybe look to see if they have dander. As I'm looking through this, my patient, she has very soft, healthy hair, and the scalp looks fine. Next, you want to assess the temporal arteries. So to take that, you're going to take your 4 fingers and lightly palpate the arteries, the temporal arteries. Yep, and I feel that pulsation, and I would grade that as a +3, which is normal. Next, we're going to go to the temporomandibular joint, which is your jaw joint. You're going to take your fingers, again, put them on the jaw joint and have the patient open and close their mouth. When she does that, I would be listening to for any crepitus as well, but it seems like as I'm feeling, everything seems in place, the anatomy seems fine, and I note no abnormalities. When that is done, you are going to assess for cranial nerve 7, which is expression and symmetry. So have the patient raise their eyebrows, burrow the eyebrows, smile, frown, puff their cheeks out. While I'm looking, everything is symmetric. What's happening on one side is happening exactly on the other side, and that is what we want. When you're done examining the head, we're going to move on to the eyes. So when you're inspecting the eyes, you want this nice white sclera. It can be a different color called jaundice, which is a yellow color, and if that's the case, that indicates liver problems or that the liver is injured. Next, you want to assess the conjunctiva. When you do this, you just want to pull down, their eyelids slightly, and it should be a nice pink-red color, and it should be a little moist. If it were to be white or paler, that can be an indication of anemia. After you inspect and look at the eyeball, you're going to assess the cranial nerves. Cranial nerves 2, 3, 4, and 6. Cranial nerve 2, that is visual acuity. You would have this patient go to a Snellen chart. A Snellen chart is a chart where it has the letters on it, the big E, followed by smaller letters. You'd have them sit and stand back about 10 to 15 feet, cover an eye, and read off a list of the letters. And then to test nearsightedness, I didn't write anything, but you would take a piece of paper and you would just hand it to them and have them read what is on that paper and read normally. I don't think you have any problems with nearsightedness or anything like that. Next, you would test the extraocular movement. So you're going to take your pen light, and I'm going to have my patient follow my pen light wherever it goes. And as you notice, she has a very smooth eye movement when she is looking and following my pen. And that's what we want, smooth movement all the way through. If we see a shaky or scattered looking eye movement, that's abnormal. Then you would want to take and have her focus on it. She's focusing really well on the pen light. That is how you test those. The last thing for the eye is to test PERLA, pupils equal round reactive accommodation. When you do this, normally you want the lights to be dimmed. We're not going to here in this case, but you're going to take your pen light and not directly put it into the person's eye, but on the side. So I just want you to look straight ahead. And when the light is on, you want to look for constriction. Both pupils constricted. While I was looking, both pupils are also round. There's no irregularity to it. And for accommodation, that would be where the pupils accommodate with the light. When the lights turn dark, the pupils would get bigger. When the lights turn on, the pupils would constrict, to a smaller size. So here we have Perla. Both are equal, round, reactive, accommodate. After the eyeballs, you are going to move on to the ears. So with the ears, you're going to do both. You're first going to want to palpate each external ear, and then you're going to take your, looking for lumps, bumps, abnormalities, redness, maybe a keloid from a piercing. You're going to take your pen light and also look into the ear. As I am looking into this patient's ear and palpating, inspecting, and feeling, her inside of the ear is very good. It's very hygienic. It looks like it's cleaned. I don't really see a lot of earwax in there. I can tell she takes care of herself. And she has a couple of piercings, but I don't notice any abnormalities on the ear. Once you are done with that, we are going to test cranial nerve 8. This is a hearing test. So I am going to stand behind my patient. They're going to cover one ear that they're not using, and we're going to repeat the test on either side. And what I'm going to do is give them a sequence of numbers that I want them to repeat back. Okay, so you can cover your left ear, that's fine. And I'm going to whisper it.
4, 10, 1, 3.
Yes. Now do the other side.
5, 6, 8, 4.
Okay. I can tell that her hearing is correct because she passed both of the sequence of numbers that I gave her. After we are done with the ears, we are going to move on to the nose. So, of course, you want to start by inspecting the nose, look for any abnormalities, maybe look for a broken nose or something. Then get your pen light, look up the nostrils. Maybe there's inflammation, redness, maybe there's a blockage in the nose of some sort. You just want to inspect and look. And using a light can really help look. And they look good. There's no irritation that I can see. Now we're going to check each nostril patency. So the patient's going to breathe normal, but we're going to cover one side of each nostril and feel for their breath. Okay, and both sides, I felt that same strength of the breath coming out. It's not like super strong, but it is coming out evenly on both sides, and that's how you check the patency. Next, you want to check for smell using cranial nerve 1. Let me go get what I brought in real quick. Sorry, I forgot this scent. I forgot my backpack. I'm gonna have you close your eyes, and I want you to identify what the smell is.
Chocolate.
Yes, it is chocolate. That is great. Good job. And lastly, on the face, we are going to inspect the mouth. When you are doing the mouth, inspect the outside, maybe look for cold sores, chapped lips, a sore on the lips, anything like that. And then inspect the inside. Can you open up your mouth? Using a pen light. When you're doing this, you want to check their teeth. Do they have any missing teeth maybe? Look at their overall hygiene in the mouth. Maybe you can spot some canker sores or any type of sore on the tongue or somewhere in the area, but sometimes you can't see those sores, but you can feel them. or anything really. So now we are going to palpate the mouth. And of course, put on a pair of gloves for this. So when we are palpating the mouth, we are going to feel around the gums, the upper roof, the tongue itself, below the tongue, and the cheeks. If you can open up your mouth, I'm just going to feel around. And I'm still inspecting while I'm palpating as well, because putting my gloved finger in here can help areas that I wasn't able to see before. Under the tongue, you want to make sure it is moist in the mouth and make sure the glands are working. It is. Feel the tongue itself. Feel the upper roof. Check the cheeks. I feel no abnormalities. Everything is really good. There are no sores. All the teeth are there. She seems to be very healthy, very hygienic. We're just gonna keep this glove on. All right. Now we need to check the cranial nerves associated with the mouth, which is cranials 9, 10, and 12. So cranials 9 and 10 is, pretty much checking the uvula. So we're going in the gag reflex. So we're gonna have the patient stick their tongue out, stick the tongue blade on, and have them say ah. If you can look at the wait, and use a pen light. Okay. And what you should be looking there, what you should be seeing, the uvula should be kind of shaking a little bit when it is going ah. It should kind of retract back up, and it should be midline of the tongue. Now to test gag reflex, you're going to take the same pretty much popsicle stick, and you're just going to kind of reach back until they get that gag reflex, and she has it. Now for cranial nerve 12, that's the hypoglossal, and you just want to stick your tongue out all the way, maybe like move it around and see if it's mobile, if it's symmetric. It is. Next, we are going to move on to the neck. So when inspecting the neck, you're just going to look at the skin characteristics again, maybe rashes, lesions, anything you can see. As I'm looking, there's really nothing, maybe a few moles, a lot of freckles on the chest for sure, but nothing irregular, I would say. And we're also going to palpate the trachea, the thyroids, and the lymph nodes. Palpate the trachea. You're just going to kind of start at the bottom and work your way up, and making sure it's midline, which it is. Now for the thyroids, you're going to kind of take your forefingers and kind of lift up into the neck. Feeling for little nodules in a way, which I can feel right there. And then the lymph nodes, there are several lymph nodes. You can kind of feel them like sometimes on each side of the neck. Maybe do one side at a time and palpate the lymph nodes. And it should feel like just a little node, really, like that's what it feels like. After you palpate that, we are going to look for cranial nerve 11. This is to test the range of motion and muscle strength of the neck. So I am going to have my patient put their head forward and backwards, but resist against my hand as hard as you can. Okay, go back. Okay. You also want to have them resist a shoulder shrug. Can you lift your shoulders? Okay, put them down. And then have them move their head side to side, checking for range of motion. Can you move your neck like that? Yeah. And as I can see, she has full range of motion. After the neck, we are going to move on to the anterior and posterior chest and lungs. Let's start off with posterior. So, do you care to kind of move your feet like that so that we can see your back like this? No, put your feet like this side. Okay, yeah, there you go. So when you're doing the posterior chest, you're first, again, going to inspect everything. Look at the skin characteristics. Is it normal throughout? My patient here obviously has a tattoo, just fine. Very pretty. After you inspect and notice any abnormalities or normal stuff, you are going to then palpate. So let's palpate for symmetry first. You're going to want to take your hands, put them like on the rib cage, and pinch a fold of skin, and have the patient take a deep breath in and out. And as you saw there, my thumbs moved evenly apart and evenly back in. And that is how we check for symmetry. If they weren't to do that, if they were uneven, that would indicate asymmetry. Next, we can palpate for tactile phremitis. Take the pads of your fingers, and we're gonna go in different locations, almost like in a zigzaggy pattern, back and forth, comparing each side. And I'm going to have the patient repeat the phrase 99, which creates a strong vibration. So each time I put my fingers like each way, I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. I felt a vibration when comparing. There was a vibration on each side that I felt. Each felt the same. It's just a little vibration that you can feel when the patient speaks, is what it is. After palpating for tactile phremitis, we are going to percuss, which is just a light tap. When you are percussing the chest, the lungs specifically, you're going to hear resonance, a low-pitched resonant sound. The shirt kind of, like, normally there would be like a gown. The shirt clothes kind of falsify what you hear. So, but you would still continue down, going all the way, and then eventually kind of going on the sides, the lateral of the lobes. Now for auscultation. We are going to follow that same exact pattern of what we did for percussing, and you're going to listen for a breath at a time on each side, comparing each side that you listen to. What you want to hear is normal breath sounds, vesicular, bronchofascicular, and then also adventitious sounds like stridor, crackles, wheezes, things of that such. And you're going to use the diaphragm of your stethoscope, starting here at the base really of the shoulders and working your way down. And then again, you kind of go off to the side of the rib cage. So listening from the posterior side, I do not hear any abnormalities. Everything is clear. It's a normal breath sound on each side. So now I'm gonna spin you around, and we are going to do the exact same thing on the anterior side of the chest. Again, we're going to inspect everything there is on the chest. Is the skin distribution the same? Any rashes, any lesions, any wounds, any abnormalities? As I am looking, everything looks really well. Then again, we're going to palpate for symmetry. So, again, you're going to take your hands and put them on either side of this patient's rib cage. And as you saw, the same thing happened. You don't pinch a fold of skin here, but your hands, when you're doing that, you can notice that my hands are moving evenly in and out as the patient breathes in and breathes out. And that is symmetric. Then we're going to palpate again for tactile firmitis using that same phrase, 99, since it creates such a strong vibration. 99, 99, 99, 99, 99, 99, 99, 99. Okay. So obviously this patient has breasts, and one way to do this assessment would be to pick up the breast and feel the chest wall itself, because the breast itself has a lot of tissue in it and it really dulls out the sound and percussion and auscultation. Each side again, I felt the same vibrations on each side. Comparing it, it felt normal. And now we are going to percuss the chest. Pick up the breasts, and then you don't have to right now, and then percuss underneath the breasts. The clothing really like dulls out the sound, but when you're percussing, you don't want to do a hard tap. You just want to do a light tap to where you can hear it. It doesn't have to hurt. Now, to auscultate the anterior chest. Again, have the patient do one full breath while you're listening, and it's going to come in a zigzaggy pattern. Can you pick up your breath? Again, no wheezes or crackles or anything that I hear. No adventitious lung sounds at all. Just clear, normal breaths, lung sounds. After doing the chest and the lungs, we are going to move on to the neck vessels and the heart. So normally, for assessing the heart and the abdomen, the patient would be supine normally, but in this case, I want to be able to show everything. So for these assessments, I am going to have this patient set up so we can see everything. But normally it would be supine, especially for abdomen, the abdomen assessment. So we're going to inspect for JVD, which is jugular vein distension, and this can be an indication of heart failure if it is sticking out. When I am looking at this patient, I don't see any predominant artery coming out or vein coming out at all. Even if she were to move her head back, move it forward, there's still no distension of that artery at all, or vein. Now we're going to palpate for the artery, the carotid arteries. However, you want to do this one side at a time, because doing both sides at a time can include the arteries and it can harm the patient. So just take your forefingers and just put it right here, pretty much underneath the jaw, and feel for that pulse. And that is one strong pulse. I give that a +3. It doesn't bound or anything. Do the other side. And it feels exactly the same on the other side. Very comparable. Now, for the heart, you would inspect the chest, but we already did that with the lung assessment, so there's no need to do that again. But, let me go on this side. But we would palpate for the apical pulse. So, you're going to start at midline, work your way down till you get about right here in the center of your breasts. I'm gonna have you pick up your breast again, just as your left one. And you're gonna put it right under and feel for that apical pulse. Okay. And maybe you would want to listen to it for a full minute, which is how you count the heart rate, which is one way you can count the heart rate of the patient. And then we are going to auscultate the heart sounds. There are 5 points: the aortic valve, pulmonary valve, Erb's point, the tricuspid valve, and the mitral valve. First, we start off with the diaphragm, listen to all 5 heart sounds, and then we listen with the bell and go through all 5 heart sounds. What we are listening for is a lub-dub, such as like lub-dub, 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 and you want it to be that same pattern of lub-dub throughout. You're also going to listen for murmurs and any other abnormal heart sound, like an S3 gallop perhaps. You can hear that sometimes. And patience. So here's the aortic valve, pulmonary valve, Erb's point, tricuspid valve, and then with listening to the diaphragm, I hear that lub-dub, lub-dub, lub-dub sound. Sounds really good. And then do the same thing with the bell of your stethoscope. And then for the mitral, she would do the same thing. It's okay. I won't make you do that. Everything sounds really good. I mean, I heard the lub-dub. Everything is great so far. I am realizing something I forgot to do with the mouth. So let's go back to the mouth real quick, if possible. Forgot to grade the tonsils.
Okay,
So if you could stick your tongue out again and like really open up your mouth wide so I can see your tonsils. I am not seeing tonsils. Do you have tonsils?
I do not.
Awesome. Okay, so since she has no tonsils, you would grade this as 0, which is like absent, no tonsils. And I believe a 2 is normal tonsils. When did you have them removed?
I was 5.
Okay. So she had her tonsils removed at the age of 5. That just came back to my mind. So after listening to the heart and the looking at the neck vessels, we'll move on to the abdomen. So usually we inspect, palpate, percuss, then auscultate. With the abdomen, we inspect, auscultate, percuss, then palpate. We do auscultation before percussion and palpation because pushing on the stomach can create increased peristalsis, that one word, and it can falsify the interpretations of the abdominal sounds. So when you're inspecting, you're of course going to look for symmetry, as you know how the belly should be, very symmetric. Even as they breathe in, sometimes that belly breathes, in as well, and just make sure it's doing the same movement on either side. You can also sometimes see a pulsation usually on pretty thin people is where your aortic is like pumping blood through and it pulsates right here, but you can normally feel it upon palpation, which we'll get to. After inspecting for any abnormalities on the belly, we are going to listen to the abdomen and auscultate. So what you want to listen for is a cascading gurgly sound for anywhere from 5 to 30. Anywhere below 5 is hypoactive. Anywhere above 30 or 35 is hyperactive, and those are abnormal. We would listen to a full minute on each side, but I'm not going to, just for time's sake. And you're going to start in the right lower quadrant, to the right upper quadrant, to the left upper quadrant, going down to the left lower quadrant in a clockwise pattern. Again, normally the patient would be supine, but I want to be able to see what is going on.
And then normally before auscultating, I would have looked at my patient. I would have kind of laid supine on the bed and inspected her abdomen from the side to look for any distension, bulges,
And right off the bat, I can, or maybe like after a second or so, there are already cascading gurgly sounds.
her abdomen is the same color as
Next, you would percuss, but the rubric doesn't call for percussion, it just calls for light palpation, so we're gonna do that. Lightly palpate each quadrant, following how we did in this pattern like before, the clockwise pattern, starting with the right lower quadrant. So what you're doing here is you're kind of getting an overall feel of the belly, and you're kind of looking for any areas of tenderness, if they're in pain. Do you feel any of that? It's okay. Okay. So everything is good here. And then when you are palpating for that pulsation, you would kind of, go midline and go a little to the left. It should be.
No, I think I messed up a lot. I'm just worried if we actually have to look their shirt.
Okay, I'm not really feeling it. It would be better if the patient were supine, but it's okay. All right, so after the abdomen, let's do the upper and lower extremities. So what we do on this arm, we will do to the next. So starting off, we're going to inspect. Right off the bat, I see this tattoo. I see a lot of freckles. Nothing that seems out of ordinary. Look at hair distribution. We'll look for edema. We'll look at the nails of the fingers. Is there clubbing? Is there cyanosis? If so, this could be an indication of respiratory distress. Everything looks good. Feel the skin temperature when you're palpating. Of course, on everything else that you're palpating, you're going to, of course, be feeling the skin temp. It's dry. It's warm. Feels nice. It feels like good skin. Abnormal feelings is like a cold arm, paler, maybe the 6 P's, pain, paresthesia, that sort, and that can the 6 P's can indicate poor blood flow. So we're also going to check skin tuber. When you do this, you pinch the skin up and just watch it fall down. So immediately the skin snaps right back, if you can see, and if it were to stick straight up and take a little bit to go down, that would indicate dehydration, but she is good. She seems well hydrated and everything. Now we would check cap refill. So to do that, you'd kind of go to the fingernail base. You can go on the side of the fingernail, press down, take it off. You'll see this white blanching, but right away it goes away back to its regular color in less than 3 seconds, and that is normal. And of course, we would repeat everything on this side, looking for edema, hair distribution, any abnormalities, feeling everything. Everything is awesome. Warm and dry. Checking the skin tuber on this side. And the cap refill. You can do several fingers if you really wanted to, and everything looks good. Now we would do the legs next. I'm gonna pull my patient out maybe a little more. There we go. Okay. So usually, this is obviously a younger patient. You would check for varicose veins, but there aren't any. It all looks good. And you're gonna check hair distribution, the color, the temperature of what the skin feels like, any edema in the feet or anything. And when you, I'm gonna take off your socks.
Okay, that's fine.
And you want to, the feet are especially a place for edema to go to. So everything looks good. Your feet are a little cold, but sometimes cold feet's pretty normal.
It's very normal for me.
Yeah. And then you would want to spread the toes, look at the nails, look in between the toes, look at their feet hygiene. Some people don't like to really keep up with that stuff sometimes. So now we're gonna go back and go through the pulses. So we are going to compare each pulses, starting with the brachial, which is located right here on the brachial region. You're gonna take your 4 fingers and lightly, so you can see, rest your arms. Each side feels regular, feels even. I would grade this as a +3, as a normal pulse. Now for the radial, you're going to take your 4 fingers again and place them right here on the radial pulse, which is on the thumb side. Everything is good here once again. There are femoral pulses, but because it's kind of close to the privates, I'm not going to try and pulse or check the pulses, but they're right here by the inguinal area, and you would kind of have to press a little harder to feel those pulses. Next is the popliteal pulses. So if you could just scoot up a little in your seat when you're checking this pulse. My patient's a little short, so her feet are dangling, but normally you would want this just being the foot flat and of course the knees bent. We're gonna take both hands, get right underneath behind the knee, and kind of feel for this diamond shape area. Okay, yep. Do the other side and compare. So personally, I think this one felt a little stronger than this knee, but it could the pulse, but it could have been my placement of the finger.
Okay.
I would probably grade, if I were doing the popliteal pulse, I would probably grade this as +3 and +2. Next is the tibial. I'm going to lift my patient's feet so you can see exactly where it is. It's located here on the inner of the ankle. Take your 4 fingers and, you know, feel for a pulse right there on the insides of the ankle. Here, I'm going to have your feet put down actually. Yeah, I can feel it a lot better when it's dangled down. And do the same thing on the other side. I would grade those both as +3. So if I had to guess, these two are also the same grading. It's just, I don't know, I felt maybe it was my hand placement on that one. Anyways, the final pulse that you are going to check is the pedal pulse. You are going to go between the big toe and the second toe and make your way midline until you kind of reach your foot, the bone of your foot. Take your 4 fingers and lightly palpate in that region. Yep. And let me do that side. I feel both. So normally if you can feel the end of the pulse on the feet,
having pretty good blood flow.
After the upper and lower extremities, we move on to the musculoskeletal. So, musculoskeletal is range of motion and muscle strength. We already checked the next head of range of motion and muscle strength, so let's start with the shoulders and work our way down. So, I'm going to switch you back up just a tad bit. You can move your shoulders back, look. Can you do it all the way around? Check their elbows. Can they rotate their elbows all around? What about the wrists, the fingers? Okay. Before you stand up, go ahead and put up your feet and maybe roll your ankles. Can you bend your toes? Okay. All right, go ahead and stand up. We have the spine to check. Can you rotate like that? Just fine. Okay, can you bend your toes? Bend to your toes. Okay. And then supine, if the patient were supine. Oh, no, you can stand up and do it. I want you to check your hip, like, check for range of motion by going like that with your hip. No, do the other side. Okay. So she has some pretty good range of motion, yeah. Now we're gonna check for strength. I'm gonna have her resist against my arms. So just go ahead and stick them straight out. Okay. And resist. Okay, now your wrists. Hard as you can. Okay. And your hands. For hands, we do a grip strength. So I'm gonna have you grip my fingers as hard as you can. Okay, and I would give that as a strong hand grip. Now we move on to the legs and check for that. Same thing with the legs. So go ahead and resist against my hands right here. Well, yeah, hold them up.
Straight out.
Yeah. And resist. Good.
I hope I'm in a rolly chair.
Is it your ankles? Okay. And then I want you to flex your foot up and down like that. This is plantar and dorsiflexion. Okay. And can you do the other foot? As I am comparing both sides have the same arm strength, the same leg strength, the same range of motion for comparing. Now, we're going to check this patient's gait and balance. So if you could stand up. And we're going to have you walk heel to toe, straight there and straight back.
Okay.
Okay,
Ready?
so
Mm-hmm.
this is Paula Lover. I'm going to be doing my health assessment video, and I'm going to start by listening to throat sounds.
Good. Now I'm going to have you touch your toes.
The right one has
As she touches her toes, this is a great time to check the spine. Make sure it is pretty straight all across. Really feel. Okay. You can stand back up. Can you bend your knees at all? Maybe like in a squat? Yeah. You can do that pretty easily. Okay. Good. And I believe that is it for the musculoskeletal. So, lastly, the last examination we have is neurologic. The neurologic examination. I'm going to start off by having you close your eyes and look at the camera. I'm going to take my pin light and start with the face and see if she feels a light touch. And if you feel the light touch, I want you to say yes. Ready?
Mm-hmm. Yes. 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 Yes.
I'm going to move to your arms and your hands.
Yes. Yes.
Now let's move to the legs and see if she can feel light touch with her legs and feet.
Yes. 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 Yes.
Okay, good. After that, I want to test cerebellar function. So let's do the upper extremities first. A way to test this is by having the patient expand their arms and going to touch your nose, just like that.
Sound clear? Wheezes, crackles.
Okay, good. Now to test the lower extremities, you're going to run your heels to the opposite shin.
Lung sounds. You hear both vesicular and
Yeah, good. Everything is normal there. If they weren't able to do that, then that would be considered abnormal. Now let's test, I butcher this word, diagnosis. I'm going to have you close your eyes. I'm going to give you a random item and I want you to be able to tell me what that object is.
A pin.
It's my pen light, but it's still a pen. Good. Next, we do the deep tendon reflexes. I tried looking for a reflex hammer and I don't have one, so the reflexes might not work that great, but I can still go through and show how to do it. So for the brachial reflex, I'm gonna have you flex your arm. You're gonna feel this go up on this and feel this tendon it's like a cord, okay? And once you feel that cord, take your fingers, make sure it stays right there, and now relax. Yep. So the tendon is right around here, and you would take that reflex hammer and go put it briskly into one spot, and this should have a great reflex. I don't know how well it's gonna work without the reflex hammer, but we'll give it a try.
So, yes, that means you can put your. So we have pedal pulses here at.
Okay, her fingers kind of moved a little bit, so that's something. I don't think I don't have the hammer. I feel like it would definitely be a lot better if I had the hammer. You would repeat on the other side too. Next, let's do the tricep deep tendon. So to check this one, I want you to flex your arm out. This tendon is located right here. Now, relax your arm. Yeah, you're gonna have them relax it and dangle it. And with that reflex hammer, you would hit right in this tendon area. That one did it. Yep, there's that reflex. So it's bouncing, it's doing what it needs to be. The last one in the arm, oh, and repeat on the other side. The last one in the arms, just dangle it like so, is your brachial radialis. Go where the radial pulse is, go 2 to 3 inches above that site, right here. And, you know, take that reflex hammer, the fingers should kind of reflex with that. I think it would work a lot better if I had the hammer, I'm sorry. Okay, well that's where the area is. Next, let's do the patellar and the Achilles. So the feet needs to be dangling for this. Now this is a pretty common one. It's this knee right here. The tendon will be located right here. You can kind of feel it, and you're gonna do the same thing, brisk hit. Yeah, there we go. And you kind of, if you could see it, it did jump up a little. It's just kind of hard to see. Okay. And lastly, we have the Achilles. So the foot needs to be completely relaxed for this. You would take your hand, kind of help lift up the foot, and the Achilles tendon is literally right in the back where exactly you would think it would be. And then you would hit it with that reflex hammer as well, just like that. Now let's move on to the Babinski reflex. So I'm gonna do this, sorry. You would take an object of any sort and you're going to go in this motion, starting from the outer foot going in. Good. So the feet did not fan out. If they were to fan out when that happened, that's an indication of like some type of damage or increase in cranial pressure going on up there, and it is a positive sign, and it is abnormal. Babinski reflex is only normal in babies. Okay. And the last test we are doing is the Romberg test. So, go ahead and stand up for me. To test, you have your patient stand up straight and close their eyes. And she is balancing, she's not swaying. Of course, you want to stand behind in case they were, but she's doing really well and she's not swaying or anything. So this is a good test. She's fine. You go ahead and sit down. And I believe that is it for my assessment. Thank you for listening.